right now, we are all in the same boat of being left without access to primary care.
We realized through virtual care that we were talking to people on the phone who actually had to be seen in order to get proper care and not have a mistaken diagnosis. And we saw that all of our colleagues were closing down primary care, so family physicians, others in CHCs, things were closing down, and the majority weren't working and seeing patients, but were taking phone calls, and not everybody was taking phone calls. And then we realized we were getting phone calls from patients who were orphaned prior to this and didn't have a family doctor, and they maybe were using walk-in clinics irregularly, and suddenly there was this huge deficit of primary care in the community. And primary care is the underpinning of the system for prevention, chronic disease management, not progressing, vaccinations, acute care, chronic care, and it's the gatekeeper for the system, and it handles probably 80% of what people need, and patients weren't getting access. But the interesting thing is we've been used to treating patients who don't have access, and those would be refugees, undocumented forced migrants, immigrants coming in the 3-month wait, returning Canadians, people who are here on work visas and have been between jobs and maybe don't have OHIP. So we've been used to seeing people, newcomers, in different categories not having access to care, but suddenly everybody didn't have access to primary care anymore.
Right.
So our team all came together. Gazala here, the nurse practitioner, Joanna White, our nurse, Libby, our director of center operations. We all brainstormed how this was going to happen. And we realized that the safest way to do this was a tent.
Because the tent provides a natural ventilation, and it's also been structured internally to have the flow come through the tent, and in the tent there is a complete separation down the center where we can see each other, the provider and the patient, and we can actually see the symptoms.
We've thought about safety parameters and making sure that all of the facets were in place to make sure we're ensuring our safety, but as well as the safety of the patients, and just promoting to make sure that the patients are comfortable coming in. So I think that generalized fear of patients not wanting to come in, we're trying to dispel that right now by having the setup that we have. So we're screening on the phone, we're still doing the care over the phone. Patients have to make an appointment. I think it's the safest way right now to make an appointment over the phone. Doing the screening online over the phone, and then having them come in to see us if there's a need to see us, but we're offering that service so that we can do it safely outside with the tent, with the negative pressure, with the World Health Organization guidelines to help us, and we've had great support doing